thank everybody for being here today to discuss how the Romney-Ryan budget is bad for Pennsylvania. Labor unions were part of the coalition that helped pass Medicare and Social Security, and it's been labor unions and their allies that have fought to protect and expand these programs. Woo! And in the beginning, conservatives openly opposed these programs, claiming they would bankrupt the country and stifle business. But these programs grew in popularity, and so much so that they became the third rail in American politics, which means if you touch it, you face political death. Conservatives have continued to play the game, though, and they keep looking for ways to tweak and adjust the way that they approach the dismantling of Medicare and Social Security. At the end of the Bush administration, the term privatization was quite popular, and so they tried to create private accounts for Social Security. Americans easily saw through this and rejected that idea, and now they're pushing what they call premium support for Medicare. Now let's be serious, it's a coupon. Medicare is a promise. Because my grandparents have Medicare and Social Security, my parents didn't have to rely on my parents for financial support. And my parents in turn were able to support their families. They were able to send us to college and get us started in life. That wouldn't have been possible if they were responsible financially for helping my grandparents as well. And the same's true for me and for most of us. If my parents had to rely on me for their financial support because they didn't have Medicare and Social Security, I wouldn't be able to provide for my family or pay my mortgage or send my kids to college. The Romney-Ryan budget would end the promise of Medicare. It would provide us with a coupon to go out and buy private insurance. As a unified coalition, we fought to create and protect Medicare, and we're prepared to continue to fight. And when conservative opponents come up with another great idea to supposedly save Medicare and Social Security, we'll be there to fight.
Medicare is a promise, not a coupon. I think that's awesome. This is an awesome plan, actually, if you're the CEO of a major insurance company. Any CEOs here? Not today? All right, this is actually not such a great plan for us. It puts so much more control, so much more power into the hands of insurance companies. It lets insurance companies decide what benefits seniors really need. It lets insurance companies decide how much the premiums for Medicare should really cost. And so as the healthcare costs rise, which with more and more power put in the hands of the insurance companies, they're going to, this coupon that we're given, it's capped. And so seniors are going to be left to have to pay this difference or forego care altogether. I don't know if this sounds familiar to anybody, but they tried, our opponents tried last year to privatize Medicare with these same tactics. They were not able to for just one reason, and that's because of you. The health insurance companies wanted it this badly last year. Our opponents wanted it this badly last year. They weren't able to do this last year because folks like yourself stood up and said, no way, hands off my Medicare. That's the only way we're going to protect ourselves again this year is if we stand up and fight back. It's the same thing they want to do to Medicaid, the guts to Medicaid. Half of the people on Medicaid are children. The other half of the people are seniors and folks with disabilities, and most of those folks, especially in Pennsylvania, rely on Medicaid for long-term care. As we're gutting these programs, we have to remember who it is we're taking away from. It's our seniors, it's our children, it's the people with disabilities, it's the people we should be fighting for. It's not the insurance companies we should be fighting for. So I just want to say thanks to everybody.
My name is Barb Stakes. I went without insurance for 3.5 years, not even because I couldn't, well, I couldn't afford it because I was offered a policy for $835 a month with a $5,000 deductible. And Aetna denied me altogether. And the reason was because I have a pre-existing condition, which is a seizure disorder. Now, this isn't epilepsy, and in fact, the medication I was taking controlled the seizures for more than 10 years. So and even if I had a seizure, you're not life-threatening, you just have the seizure. You wake up, you sleep for 8 hours, and that's it. So I was denied insurance. I was for 3.5 years. And then finally, when the ACA took over, I was able to go onto the Affordable Care Plan, PA Fair Care, because of the Affordable Care Act. So I'm here today to support the Affordable Care Act and Medicare. I'm going to be turning 65 next month, October. So, you know, it's great. I look forward to that, and I feel, you know, lucky. Especially because I never got really seriously ill during those 3.5 years. So I was lucky. They want to get rid of Medicare. They want to get rid of Medicaid. They want to get rid of the ACA. So where are we in that case? We're before 1965. We're going backwards. That's what these people want. I don't know why. They have plenty of money. They just want more, and I don't know why. They just want to make the rest of us totally destitute. Thank you.
About 4 years ago, I decided that I wanted to learn how we access health care in this country. And I started interviewing people and painting their portraits as a way to tell the story. And if you go online and click on the portrait, the story pops up. I discovered a very disturbing trend in these past 4 years. And there is a group of people out there, middle-aged people, suffering and dying sometimes before they reach Medicare, waiting to get onto Medicare. It's a demographic we don't talk about very much, but these are the silent sufferers in our country, which really underscores why Medicare is so important. This is a portrait of a woman whose husband died at 55, and with his death, she lost her insurance as well. And she remained uninsured for 18 years. Now imagine that, 18 years of waking up and thinking, what if something happens today? I don't have the money. So you live with that fear. Well, something did happen in those 18 years. Toward the end of it, she went to get glasses at a Walmart. And the optician said, listen, you know, you have a problem, go see an ophthalmologist. She got the money together, she went. The doctor said, you have a detached retina, you need an operation right now. Now, she didn't have the money. They would not take a payment plan. A friend offered to co-sign for something so she could get this operation. No, they said, listen, we're sorry, we've been screwed too many times. You're gonna have to show up with the insurance or the money. Well, it took a year. She and her friend finally got it together, and she got the operation. And the new surgeon said to her, we're really sorry. We're sorry that you lost 85% of the vision in one eye because you didn't, if you had come to us sooner. This is what I say. We're sorry. This country is sorry. This is a woman who raised her children, who paid her mortgage, who contributed to the economy. We're sorry. This is not the greatest country in the world until we can address what happens to people like this woman who waited and is on Medicare now, and the many millions like her who have waited and relied on Medicare being there for them. Who will speak for these people relying on Medicare to be there? Certainly the Ryan budget doesn't speak to it. Trying to repeal the health care law, which strengthens Medicare, does not speak to helping these people falling through the cracks. And I'll tell you who is not speaking. My Congressman, Mike Fitzpatrick, is not speaking to people falling through the cracks. This kind of thing troubles me very much. It's why I speak up. There are 2.2 million people, seniors, on Medicare in Pennsylvania today. 2.2 million. That's 20%, almost 20%, 18% of the population in Pennsylvania. Every fifth person you meet is on Medicare. That is why it is so crucial that we uphold the Affordable Care Act, that my congressman participate in a forum, and this is an open invitation to him, to talk about the Affordable Care Act, Medicare, the Ryan budget, and what's good for seniors. Thank you very much.
Before that, a lot of these people were marked indigent. After 19